My name is Justin Ingram, and I'm here to introduce HIV Negative Me, a DNP-led primary prevention program which focuses on reducing new HIV infections among African American gay and bisexual males. Here, the objectives of this presentation are outlined. So what exactly is human immunodeficiency virus? Simply defined, HIV is the virus that causes AIDS. It weakens the immune system by attacking T cells, which are important for fighting infections within the human body. Despite HIV and AIDS being identified in the early 1980s, there is still no cure or vaccine. Without treatment, the immune system becomes so weak that a person becomes vulnerable to opportunistic infections and rare cancers that can lead to death. Now let's look at ways of contracting HIV. First is through the transmission of bodily fluids, which most often occurs during unprotected sexual intercourse. Another mode of transmission is through the sharing of needles among IV drug users. Blood transfusions still pose a threat for contracting HIV, but it is much less common due to rigorous testing of blood products before they are administered. Lastly, it is possible for an HIV-positive mother to pass the disease to her child during birth. Next, let's examine HIV among African Americans, but especially among young gay and bisexual African American males. If we look at HIV infections between the years of 2010 to 2014, we see that African Americans accounted for 52% of these among people ages 13 to 29. 89% of these new infections were attributed to homosexual or bisexual behavior. The highest number of new infections occurred in gay or bisexual males at the young ages of 22 to 23. Let's look further at why HIV is a major health concern for African American gay and bisexual males. Here are some statistics to expand on its impact within this population. There are approximately 50,000 annual infections in the United States. In 2018, the CDC estimated that African Americans accounted for 470,000 out of the 1.1 million diagnosed cases in the U.S. 43% of all infected individuals were African American, even though they only accounted for 12% of the total U.S. population. These numbers are alarming, but if we look at newly diagnosed cases of HIV in 2016, we see that 58% of them were Black or African American gay and bisexual males. In 2017, Black or African American gay and bisexual men accounted for 26%, or 10,070 of the 38,739 new HIV diagnoses worldwide. It is also important to mention that in 2016, there were 2,406 deaths in the United States among African American gay and bisexual men who were diagnosed with HIV. As we look at this slide, we can see some important numbers regarding new HIV diagnoses in the U.S. among gay and bisexual African American men in 2017. Of all new diagnoses that year, gay and bisexual African American men accounted for 37%. 3 out of 4 of these were between the ages of 13 to 34. Here the percentage of HIV diagnoses in 2017 among gay and bisexual men is broken down. There were 38,739 new diagnoses that year. 70% of those were among gay and bisexual males. We see that Caucasians accounted for 28%, Hispanics and Latinos made up 29%, and the largest group was African Americans at 37% of new HIV diagnoses in the U.S. in 2017. In that same year, 8,164 of those diagnosed with HIV were between the ages of 13 to 24. 83% of those young individuals were gay and bisexual men. African Americans represented over half of those infected at 51%. It is easy to see from this information that something must be done to address the alarming rate at which this disease continues to spread among young African American gay and bisexual men. This graph shows new HIV diagnoses among gay and bisexual men based on their ethnicity in the year 2017. Look at how rates increase between the ages of 25 to 34. Perhaps a primary prevention program among college-age students can help reduce this number. Now let's look at the different levels of disease prevention. Primary prevention focuses on reducing exposure to disease and preventing a person from contracting an illness. Secondary prevention focuses on early detection and the slowing of disease progression. This level of prevention occurs when a person already has disease. Several screening methods can be used. Examples are pap smear, colonoscopy, or a prostate exam. Tertiary prevention occurs when significant disease is present and focuses on slowing the progression or curing it. Efforts are made to rehabilitate individuals to their maximum level of function and productivity. Physical therapy and occupational therapy are examples. Let's focus now on our interdisciplinary prevention program. There are certain questions that need consideration when creating such an intervention, such as who is our target population, what level of prevention are we going to use, and then also what specific intervention will we use. So our target population is college-aged African American gay and bisexual males. We will use a primary prevention program, and the specific intervention will be a revolutionary drug called pre-exposure prophylaxis, or PrEP. So what exactly is pre-exposure prophylaxis? PrEP is a primary prevention medication that is available for everyone, but is targeted toward high-risk HIV-negative individuals. It is a combination of 2 prescription medications and sold under the name Truvada. When taken as directed, it reduces a person's chance of contracting HIV through sexual contact by approximately 99%. The drug is much less effective when not taken on a daily basis. It is also not effective against other STDs, so condoms should still be used during sexual intercourse. Here we see that the CDC, the Centers for Disease Control and Prevention, endorses PrEP and encourages conversations explaining its importance and the impact it can have at reducing the number of new HIV infections. So now let's look at HIV Negative Me, our primary prevention program, which will be led by the DNP. Its purpose is outlined here. It's to provide education and other primary prevention techniques concerning HIV infection to at-risk populations, but especially gay and bisexual African American males enrolled in colleges and universities. Also to encourage all eligible individuals to begin a PrEP regimen and agree to compliance, future testing, monitoring to evaluate its effectiveness, and also to help with looking at does it reduce new HIV diagnoses among the target population. So now how does the HIV Negative program work? It is based out of Birmingham, Alabama, and will focus on bringing education and prevention techniques to colleges and universities via a mobile unit. Due to the high numbers of HIV infection among our target population of African American gay and bisexual men, it will travel to all historically Black colleges and universities within the state. Through coordination with faculty and administration among these institutions, we will be allowed to bring this program on campus to the age group most affected. It will include education focusing on the alarming rates at which HIV continues to increase within this demographic and emphasize the severity HIV is still having among African American gay and bisexual males. This will allow us to introduce PrEP, explain how with consistent use it can significantly reduce the number of new HIV infections, and allow interested individuals to enroll in the program. Education will be provided describing how HIV is not a disease of the past, but an ever-present risk among anyone engaging in unsafe sex, but especially among gay and bisexual African American males between the age of 13 and 24. Pre-exposure prophylaxis will be introduced and explained as to how it can prevent HIV infection when taken correctly. For those interested in beginning PrEP, HIV testing will be provided to ensure a negative status. In the event a person tests positive, counseling will be provided and referrals made to resources and organizations that can provide secondary prevention mechanisms. Once an individual has tested negative and agrees to begin taking PrEP, they will be enrolled in the HIV Negative Me program. Individuals who enroll in the program will give permission to be followed so compliance can be monitored and also agree to routine HIV testing. They will receive emails containing continuing education about HIV and also invitations to participate in upcoming HIV Negative Me events so they can become advocates for the program and speak to peers about its importance. Next, let's look at the IDT team members involved in the HIV Negative Me program. This program will require a committed interdisciplinary team who are willing to volunteer their time in order to present its education to as many at-risk individuals as possible. The members of the team include the DNP, a medical doctor, RN or LPN, and also a medical social worker. The DNP will be in charge of arranging engagements with college campuses and overseeing the IDT. The medical doctor will be responsible for prescribing PrEP to individuals who choose to participate in the program and meet requirements. The RN or LPN will perform rapid HIV testing and a physical exam to ensure participants are eligible to receive PrEP. The medical social worker will be available to counsel those who may have a positive test result. If this should occur, referrals will be made by the MSW to ensure secondary prevention techniques are implemented as soon as possible. So how will we measure success in the program? First, we will look at the number of individuals who enroll. A greater number of enrollees will hopefully represent a decrease in the number of new HIV infections within this population. Participants will also be monitored to ensure consistency with follow-up appointments where they will be tested for HIV and also ensure compliance with medication regimen. New prescriptions for PrEP among people who attend the program will be analyzed as a way of measuring success. And of course, we will look at new HIV infection rates among gay and bisexual African American males, as the ultimate goal of the program is to reduce this rate. Now let's look at some leadership competencies for the APRN that are necessary for implementing this program. First, we have diversity. Diversity is important because when dealing with HIV, we want to make sure to avoid any prejudgment. Assumptions should also be avoided, especially those related to race, to maintain trust within program participants. Another important leadership competency is the ability to form relationships. To accomplish this, a pleasant disposition should be maintained in interactions with your coworkers, also with program participants. This includes having a sense of humor, which can help give people a sense of ease. This competency is very important when dealing with a topic such as HIV. A person's level of comfort could be the difference between them deciding to participate in the program or walk away. Two other leadership competencies that are important are communication and also learning capacity. With communication, you need to be able to reach that difficult audience. And then with learning capacity, you need to be able to listen to the opinions of other people and also recognizing that everyone is unique. So in conclusion, we can see that HIV is still a threat to the population as a whole, but especially to gay and bisexual African American males. While secondary prevention is making great strides in detecting and treating the disease earlier, primary prevention is still the #1 way of eliminating the spread of this disease. By utilizing a program such as HIV Negative Me, which incorporates PrEP, we have an incredible opportunity to educate those high-risk young individuals and provide them with medication which can dramatically decrease the spread of HIV. A strong grasp of leadership competencies will be essential in guiding the APRN to successfully implement this program while remaining flexible to accept input which may enhance its ability to affect and benefit the majority of this at-risk population. Thank you very much for your time.